Good morning. Uh, Having little technical difficulties, so let me be sure everything is okay. I'm trying to do a sound check here now. Okay, here I am. Check, sound check. Yes, sound check is perfect. We're all set to go. In the morning, we had a little bit of glitches, but we're all over. Good morning. Today is Saturday, March the 4th, 2023. This is our Saturday morning yoga therapy class. As we mentioned before, and as you know, that all of our presentations are based on our own individual and personal experiences. At the beginning of the year, we started how to start an asana practice, a pranayama practice, meditation practice. Then we talked about yoga therapy for gut health, which is the most important part because yoga and Ayurveda says we are what we digest, not what we eat. And how to digest is the activation of parasympathetic tone. Then we did a presentation, Ayurvedic yoga therapy, which was based on our yoga teachers training class. And today we'll talk about yoga therapy for metabolic syndrome. I'm going to talk a little bit about metabolic syndrome first before we get into our practice session. Okay, let me be sure we are okay here. Okay. Metabolic syndrome is our the lifestyle related disorders, which is keeping all of us in our chronic disease status and the number one killer for us at this time. So let me explain a little bit of metabolic syndrome and what is the present concept, physiology behind it, so you will understand what will be the rationale for yoga therapy. First, we have a cluster of lifestyle related disorders. For example, diabetes, high blood pressure, coronary artery disease, or what you call heart disease. Then we call a dyslipidemia. Dyslipidemia means abnormal fat in the blood, which is also a high cholesterol, which is called a hyperlipidemia. And dyslipidemia is a high triglyceride. This is another fat in our blood, and low HDL. HDL is the good cholesterol, which is helpful in removing our plaque in the blood vessels. And also it has other components like you call it sleep apnea, our depression, a lot of other lifestyle related conditions. Before, we used to think each one is an independent, different diseases, and we used to call them as a risk factor. Like if I have a heart disease today, which is called coronary artery disease, that I am in a high risk if I have a diabetes, if I have a hypertension, or if I have a high cholesterol or dyslipidemia. Now, the concept is entirely different. Now, the present concept is all are together, like a one syndrome. The underlying mechanism is the high sympathetic tone in our body. What does high sympathetic tone means? What it means is that we are in a fight and flight mode. Remember, in our autonomic nervous system, we have a two opposing system, sympathetic nervous system, which is fight or flight, because when in living in the nature or when trying to be living for your own self-defense, it is in response to an aggression or to a fear. A car is coming to you or an animal is coming to you. What are you going to do? Are you going to run away to save your life, or you are going to fight back? So how do you do it? Your blood pressure goes high up, your heart rate goes high up, your muscle starts to contracting. So you'll be able to run or you're able to fight. It's called fight and flight response. And this is a natural response. The opposite side is a parasympathetic tone, which is called calm and digest. Keeps us calm and quiet. And the whole digestion, like your gastrointestinal tract, from mouth to the anal canal, the whole area is supplied by parasympathetic nerve. So you need to do parasympathetic activation for proper digestion of the food and to be calm. That's what we had the last session, yoga therapy for gut health, which is we are what we digest. So the most important part for us to be in a fight or flight mode is called fear of unknown. What is fear of unknown? Today, the present day, my kid is going to school. I don't know what is going to happen to him. Is there going to be a mass shooting? I'm in a plane. I don't know if you know, last week there was a turbulence in Lufthansa flight from Austin to Frankfurt. And even the people were tossed into the ceiling, including at the dinner time, all the food particles on the plates. So I'm afraid even when you're flying, the fear of unknown, going out of the house. I'm not sure whether they're going to come back home. So this constant fear of unknown, and our body also have a called adaptive response. Adaptive response means when my blood pressure goes high up, my blood sugar goes high up, we also have a homeostatic mechanism. The homeostatic mechanism is going to take care of the response to our fear of unknown. But what happens, we are exposed to this fear of unknown multiple times throughout the whole day. So this is called your adaptable response, like when your body has that fight and flight response. Blood sugar is high up, cholesterol is high up, glucose is high up, and we go high up, body's homeostatic mechanism is going to lower it down. That is called homeostasis, called default mode network. We have a default mode network which is going to put us. But what happens before it can come down to normal, we get another fight and flight response. So go high up again. Before it comes down, it goes high up again. Before it comes down, it goes high up again. So you had a persistent rise in the blood sugar, persistent rise in your blood pressure. And we always say, hey, what it is? It is a idiopathic hypertension. Idiopathic means we don't know what is causing the hypertension. Diabetes. We have enough insulin in the body. We call it insulin resistance. We call it the receptors are not working. Beta cells are producing insulin. But what is happening is the same, called a maladaptive response. The maladaptive response can bring up blood sugar higher. But what we find out today, that this is a phenomenon which is mediated through called limbic system of the brain. Limbic system of the brain, which you call emotional brain, which is above our cortex, has an amygdala and a hippocampus, two nuclei. Amygdala responds to fear and hippocampus responds to your memory. When limbic system is activated, it sends a signal through neurotransmitters to your hypothalamus for homeostasis. Hypothalamus then sends a signal to your autonomic nervous system and also your pituitary adrenal axis for hormonal homeostasis. So this, we call it a psychoneuroendocrinology. This psychoneuroendocrinology keeps us in balance, keeps us in health. Today, present day, another important factor which keeps our emotional brain, the limbic system, activated all the time is insomnia and sleep apnea. And as a physician, you will know that sleep apnea is one of the root cause of this metabolic syndrome, including diabetes, hypertension, coronary artery disease, and dyslipidemia. So this, what we call altogether, is a stress. We have no other term to use, so we use it as stress. And always remember, there are two kinds of stress. In the eustress and a distress. Means the stress is important. You need a stress for your survival response. But when the stress goes out of the way, you get into your distress. And what is basically counteracts this sympathetic is called your vagal stimulation. We all talk about polyvagal theories, but a daily practice of yoga is the activation of your parasympathetic tone. So the whole underlying mechanism for metabolic syndrome is this stress or a high sympathetic tone, or what we call the limbic system, hypothalamus, pituitary, autonomic nervous system, your axis, have a endpoint of a high cortisol. Cortisol is a hormone of stress. What cortisol does, what it does is called a thrifty gene hypothesis. Thrifty gene hypothesis means our body thinks we may not have any food for tomorrow. So the body does have a mechanism to convert your excess sugar, what is generally the glucose, which is called an end product of our metabolism, glucose to convert into a fat through your cortisol. And that fat is your called omental fat. That is not your subcutaneous fat. This fat stays inside your abdomen, which is wrapped around all the intestinal organs. It is not under the skin, it is inside your abdominal cavity. And this fat, the omentum, is like an endocrine organ. It secretes adiponectin and also it secretes pro-inflammatory molecule. So the inflammation is underlying cause of the diabetes, hypertension, coronary artery disease, atherosclerosis, dyslipidemia, what we call a metabolic syndrome. So the buck stops here. This is the beginning of your therapy to how to take care of your truncal obesity. And the truncal obesity, you can do any amount of abdominal crunches, you do anything, truncal obesity is not going to go down. It will need the reduction of your stress response, which is basically a relaxation response and a parasympathetic activation. This is the thing I insist all the time. The outcome of yoga therapy is the relaxation response and activation of parasympathetic tone. A very simple practice, which we'll be doing it soon, and you will see we'll be doing it sitting in a chair. The people who have a truncal obesity, and this is a precursor for your metabolic syndrome. You can do all the sit-ups, you can do all the crunching, putting your hands behind. This is not going to go away. So, as a physician, how do we measure our truncal obesity? Now, as a Western physician in a modern medicine, they always take care of every patient the same. So they put a number. Men with a waist circumference above 40 inch is a truncal obesity, and women with a waist circumference above 35 inch is a truncal obesity. Now, people like us, I'm 145 pounds weight. I do have truncal obesity, a little bit. I will never get my waist at 40 inch. So yoga looks at few other things. First, it looks at the other parameters for truncal obesity. One of the best parameters is the height in inch divided by 2. That means half of your height in inch. If you're more than that, you have a truncal obesity. So I'm 5'8". That means I'm 60 plus 8, 68 inch. My truncal obesity will be when I cross my waist circumference more than 34 inch. Next one is a waist-hip ratio. Men, the hip size is smaller, so men, the waist-hip ratio normally should be around 0.9. When it goes more than that, it becomes a truncal obesity. For women, waist-hip ratio is less than 0.85. When it goes above 0.85, it becomes a truncal obesity. It also connects with your BMI. BMI is your body mass index. BMI is your weight in kilogram divided by body surface area in meters square. So BMI normally say 18 to 25. 25 to 30, you are going towards little obesity. Above 30 is definite obesity, and above 35, you are what is called a morbid obesity. Morbid obesity means you have developed enough morbidity that you need attention right now. We have yogic ways for BMI. Look at the yogic way BMI. First of all, you know, when you practice, we all practice with a health tracker. This is my Apple Watch. It has all my health parameters when I'm practicing. The first, in your wrist, when you put your wrist and put your fingers together, there will be an overlap. So there will be overlap, my middle finger and thumb. Whatever overlap generally is about an inch or inch and a half, whatever overlap, then you take your hand to put it around your arm. The amount of overlap you have, that overlap will be the separation between your middle finger and the thumb. So whatever overlap you have here, you see, this is the overlap. That overlap will be the separation between your middle of your arm, between middle finger and thumb. This is the ideal BMI for yogis. Same way, if you look at your thigh, you will go from you can touch, this is called a greater trochanter, part of your femoral bone and your knee joint. Between them half, you can put your hand and you will be able to touch your thumb and the middle finger. Let me see if I can show it to you so you'll understand better. Middle of your thigh, when you put your thumb and middle finger, you'll be able to put it together. Ideal BMI. Wrist, arm, middle of the thigh, and finally the yogic BMI is at the level of your belly button. You put your thumb on the side, bring your finger, and your middle finger will touch to each other. This is also another sign that you don't have a truncal obesity. Put your thumb on the side, lock it, bring your hand and touch middle of your finger. Please do it. People who are watching me, do it and see if you have any truncal obesity. So beautiful way of measuring, and I'm talking about this more and more because you, in a daily practice of yoga, are going to control this metabolic syndrome. And also, if you're a yoga teacher or yoga practitioner, anybody coming to you today will be asking for therapeutic yoga, and 70, 80, maybe 90% of the people comes to yoga today for underlying chronic diseases. Most of the doctors who talks to me or comes to me for yoga is they are tired of taking medication. They have diabetes, they have hypertension, they have heart disease. See, these are all same complex. It is not the risk factors anymore. And they have a coronary artery disease, they will get the 4 medication: aspirin, statin, beta blocker, ACE inhibitor. Then if the beta blocker is not going to take care of this, your high blood pressure, they'll get a more blood pressure medication. So it goes on and on and on, and they end up with the, at our age group, they end up with almost 10 pills a day. And always remember, all the side effects we're talking about pill are called in vitro study. In vitro study means you use that medication outside of our body and see this is the side effects you can get. But a friend of mine who is a pharmacist, very brilliant pharmacist, he tells me that once you take the medication, after taking 1, 2, 3, after taking 3 medications, you have no idea what these medications are doing inside your body. We're taking 5, 6, 8, 10 medications. The brilliant pharmacist, actually he understands what we are taking. So, what do we do? First, we do a daily called routine, dinocharya. Daily routine is absolutely a must for your therapy for metabolic syndrome. Slowly and slowly, you shift your sleeping pattern between 10 to 4, 10 o'clock at night up to 4 in the morning. For us, generally it's at 10, 10:30 to 5, 5:30. We wake up at 5, 5:30 without any alarm or any clock. First, we sit down in a squatting pose. Squatting pose, that means it's a relaxation response. Keep our body supple. Squatting pose will drink 2 glasses of water in a room temperature, sit down in the squatting pose, and first thing you will have a good smooth bowel movement. If you don't have any bowel movement, you do 5 asanas, which are called Shankha Prakshalan. All the 5 asanas, we have all demonstrated before, but we will do it maybe some other time. The upward mountain pose, Utthito Tadasana, oblique mountain pose, Tirjak Tadasana, west rotation pose, Kadichakrasana, oblique cobra pose, Tirjak Bhujangasana, and sitting in the squatting pose and twisting your body on both sides is called Udar Karshan Asana, massaging your abdomen. One of my friends who is a gastroenterologist, he ran all your GI studies in X-rays, which they used to call a barium mill, but they do different material now, and he showed this 5 asanas causes proper elimination from inside. He has also used all these 5 asanas for preparing for colonoscopy. So once your bowel movement, then you do brush your teeth, massage your gum, then you use a neti pot to do a jal neti. We do jal neti every single day to wash our nose. And after morning rituals, we do a morning 1 hour of yoga practice, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. Most important thing you will understand as a true practitioner of yoga, yoga is a philosophy, yoga is a practice which is called the 8 limbs practice, Patanjali Ashtanga Yoga. There is nothing called yoga and meditation, nothing called yoga and pranayama. Yoga, actually the word is a yoga, first 2 limbs, yam, niyam, asana is 3rd limb, pranayama is the 4th limb, pratyahara, control of senses, 5th limb, dharan is the 6th limb, dhyan, meditation is the 7th limb, and samadhi is the 8th limb. So all the 8 limbs are yoga. First practice you start where you are. It's a non-competitive practice. Remember the difference between a yoga and yoga therapy. Yoga practice is you are trying to perfect your asanas, you're trying to perfect your pranayama, trying to perfect your meditation practice. You are doing a practice for perfection. In a yoga therapy, you use all the modalities, all the 8 limbs, your philosophies, to access the therapeutic benefits of the asanas, pranayamas, meditation for your own individual health. Health is a self-help. Nobody can give you health. You can buy disease care, you can buy medication, you can buy a hospital, you can buy a doctor's, but health, you have to earn it by yourself. So the two components we talk about all the time, Merudanda Achal and Manasthir. Merudanda Achal means keeping your spine straight, and Manasthir is quieting down your mind. During the practice, you also follow two fundamental body's response. No pain. If you're doing any asana, if you're doing a simple spinal twist, if you get a pain, you back off. You back off and you stay in the asana. Slowly and slowly, neuroplasticity will set in and you will be able to progress slowly. Second, effortless breathing. Your heart and lung is the same organ. If your lung stops, your heart stops. People who expired, we said they expired. The last breath comes out, and what happens? Next heart stops, and the brain stops, then cellular function stops, people die. So if you put a stress in your heart or stress in your physical body or an imbalance in your physical body, it will show up in your breath. So you'll have effort in breath. Effortless breath, no pain, and in stages is the therapy for metabolic syndrome. So here I am, as you all have seen before, that this is my kneeling stool. I will sit down in a kneeling stool, and when I sit down in a kneeling stool, what happens? I keep my spine straight. I have this desk, which is your motorized desk. It goes up and down. So I keep my keyboard and computer in front. So the number one group of people who are suffering from metabolic syndrome today is the IT people. They're sitting in front of the computer, they're hunchback, looking like this, and they are the first target. I'm seeing people at the age of 30, 35, they're having diabetes, hypertension. So always tell them that if you have to practice, keep your spine straight. Or you can sit down in a chair. Like when you're sitting in a chair, so you sit in a chair, show it to you a little bit more, the chair. You will sit down in a chair, you will keep your spine straight. This is my yoga practice chair. It's a three-legged chair. See how interesting the chair is. But when I go back, I'll keep my spine straight. My body will be like 90 degree. Here, here, here. And support my feet. If my feet doesn't touches the ground, I'll put a couple of folding blanket, because slowly and slowly neuroplasticity will set in and my feet will touch the ground. From here, for a relaxation response, we incorporate few practices. First practice is your hand gestures, called Yoga Mudra. Hand is connected between your body and mind. So by quieting down your hand, you are going to do quieting down your mind. So we'll be doing a practice. We'll be doing a Kapalbhati pranayama with all the mudras as a therapy for metabolic syndrome. You touch your index finger and thumb. This is your called Dhyana Mudra or Jnana Mudra. It's a meditation mudra. You put it gently over your knees. Mind, the quieting down your mind. In yoga, mind is the content of your five senses. I hear, I see, I smell, I taste, and I touch. You quiet down your mind. And most important component is your vision. So close your eyes. In a short time, you will feel like and breathe normally and effortlessly. In a short time, you'll feel the relaxation will be setting in. May not happen in one day, may not happen in a few weeks, but it will happen. It's called neuroplasticity. So what happens when you keep your spine straight? Normally, my skeleton is going to fall in the front. Muscles in my back called paraspinal muscles, quadratus lumborum. Those muscles contract and keep me straight. So if I keep myself straight, I give some relaxation to these muscles, and in the back, which was like a stone, is like a soft pillows. It's a wonderful experience. Remember, therapeutic yoga, yoga as a therapy, is a non-competitive. It is your own personal practice based on your body's response of no pain and effortless breathing. Please, please, please don't take any pain medication and do your daily practice, because you need the pain response for your protection. Pain, the word pain comes from pay attention. Pain is happening because something is, you are doing some imbalance. So don't progress to the pain. Just stay behind your pain, behind your breath. Incorporate your breath. Lung is like a balloon. It has 6-liter capacity, and we need 1.5 liter to keep your lung open. You have a 4.5 liters air to exchange. So first, start exhalation. Remove all the toxic gases from your lung. And body, whatever disease we have, they eliminate a volatile substance. Analyzing the exhaled air from our lung, we can diagnose, large number of diseases. Exhalation is parasympathetic. Inhalation is sympathetic. Breathe out first. Slowly take a deep breath in. And breathe out longer than breathing in. Again, for a therapeutic yoga, to have a health and healing, you will be practicing your breathing or practicing your pranayama effortlessly as if it's a normal practice. All the muscles of respiration are skeletal muscles. They can be trained. Today you can do 2 seconds in, 4 seconds out. In a short time, you'll be able to do 4 seconds in, 8 seconds out. We've been doing so long, we can do about 10 seconds in, 20 seconds out. Practice, wonderful practice. Breathe out first. Breathe in with a count of 3 in. 1 and 2 and a 3. Breathe out with a count of 6 out. It's a completely effortless practice for me. Effortless breathing is you will be able to talk, you will be able to sing. So by the time you sit down with the spine straight, eyes closed, paying attention to your breath, with a hand in a mudra, you are eliciting a relaxation response, parasympathetic tone as a therapy for your omental fat or truncal obesity. Once you start reducing your truncal obesity, that is the beginning therapy of your metabolic syndrome. Another one is to incorporate a meditation with your practice. Meditation is quieting down your mind, which is happening here when you prepare your body. Yoga says you prepare your body with an asana called Sthiram Sukham Asanam. Sthiram is the stillness, Sukham is the happy, asana is a pose. When you are in a Sthiram Sukham Asanam, your breathing becomes effortless. There is nothing called deep breathing. Breathing, your exhalation gets longer, inhalation gets longer, and slowly your respiratory rate comes down. Normally breathe between 15 to 16 breaths per minute. If you simply do 2 seconds in, 4 seconds out, you get a 6-second cycle, which is very simple. You're already reducing your respiratory rate to 10. By the time you can go to 4 seconds in, 8 seconds out, the respiratory rate will be 5 per second. Then like me, I have some saliva in my mouth. Saliva in your mouth tells you that you have a parasympathetic activation, because all the salivary glands are supplied by parasympathetic nerve. I have not drank anything, I've been talking to you for a long time, but still my whole mouth is wet. A simple meditative practice is to quiet down your 5 senses. A lot of ways you can do, like, during sleep, you can cover your eyes, you can listen to your soothing music, you can smell an aroma, put a little taste in your mouth. But the best way to do it is that sitting down like this, you visualize 5 objects around you. Next, see if you can touch about 4 objects out of those 5. Next, see if you can hear the sound of the 3 objects you are visualizing. Next, see if you can smell the 2 objects which you are visualizing. And each step, you stay here for a while. Finally, see if you can taste the 1 object. So you're doing a visual, you are touching, you are hearing, you are smelling and tasting or quieting down. Next, you do a little practice for relaxation. Hand get relaxed with a mudra called Adhi Mudra or Balo Mushti Mudra. Balo Mushti Mudra means baby fist. Baby puts a thumb inside and close. That's the way the infants or a baby, everybody closes their hand like this. Look at a baby with a hand like this, it'll start screaming. Yoga says that there are 3 mudras. If you touch your index finger and thumb, put your palm high up, this is your meditation mudra. If your palm comes down, this is called your chin mudra. It opens the lower part of the lung. If you close the other fingers and touch index finger and thumb, this is called a Chinmayi mudra. It opens the middle part of your lung. And when you do the Balo Mushti mudra or baby fist or Adhi mudra, thumb inside and close, it opens the upper part of the lung. So for the hand to be relaxed, see when the hands are relaxed, see how wide separation of your fingers. When the hand is relaxed, your fingers will go in, your hands will turn all over. So you can do it with your breathing. Put your hands in front, breathe out first. I do generally with my eyes closed. Breathe out first, take a deep breath in, breathe out, and do a Adhi Mudra or Bala Mushti Mudra, baby fist. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Wrist gets relaxed with extension. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Elbow gets relaxed with called an external rotation. It gets tightened up with external rotation. It gets relaxed with the internal rotation. And we'll be doing a prayer pose to the back, which will relax our elbows. Shoulder is a ball and socket joint. You can do a shoulder rotation, put your hands in the shoulder, bring your elbows together. And bring it wherever without any pain. Eyes are closed, breathe out first, take a deep breath in, and slowly rotate your shoulder with the eyes closed. Breathe in, breathe out. Breathe in, breathe out. Generally, you do 5 to 10 in each, and then do opposite. Breathe in, go to the opposite side, breathe out. Breathe in, breathe out. You also can do a shoulder movement, shoulder shrugging. The best way to do is hold your hand high up, like this. Hold your wrist. Breathe out first. Take a deep breath in and pull it down behind your head. And the same breathing cycle, come back into the middle. Hold the opposite hand. Breathe out first. Take a deep breath in. Pull it down behind your head. Same breathing cycle, go higher. So do it few times, but follow your breath. And best way to follow your breath is to close your eyes and do it. So wonderful relaxation practice. And remember, all the muscles of respiration are like trainable muscles, skeletal muscles. Like you can do with your, say, weight training. You're doing 10 pounds. Also remember the breathing. When muscle works, you need oxygen. So when you do that, breathe out first, take a deep breath in, and breathing out to contract the muscle. Breathe in, breathe out. Same way, breathe in, breathe out. The moment you do it a few times, you'll be able to go to 12.5 pounds, 15 pounds, 20 pounds, 25 pounds. And that happens because these muscles are trainable. Next relaxation is your Paschim Namaskar. You put your hands to the back and do a prayer pose to the back. Take your hands slowly and wherever it is, keep it there. Slowly put your hands in a prayer pose. You cannot see it then. Okay, let me do it. Yes, you can say it better. So, wherever your hand comes, if you can put your hands together, then slowly turn it around. Keep your spine straight, eyes closed. You breathe out longer than breathing in, and slowly this is going to happen. Keep practicing, more will happen. Someday, somehow, and you feel comfortable. Sthiram Sukham Asanam. Remember, these are the same practices we do repeatedly every single day. But when you have the metabolic syndrome, you pick and choose. Initially, you need to do the whole body relaxation. Then you do a disease-specific yoga therapy. Can you stay here? You stay here to the point that you are comfortable. Don't push yourself, you are comfortable. From here you can do relaxation of your neck, which is called your Brahma Mudra. And you continue your Brahma Mudra with a sound of your chanting. You can do with your sound of Om, A-U-M, or sound of your bumblebee breathing. Okay. You can do in your exhalation. It extends your exhalation, and also what it does, our body has a vibration, and this vibration cancels the vibration, so your mind quiets down. So breathe out first. Take a slow, long breath in and put your neck to the back. Breathe out with the sound of a bumblebee. Listen to your body signal, no pain, and effortless breathing. The 4 postures, back and the front, then side to side. Breathe out first, take a deep breath in. See how long becomes your exhalation, which is parasympathetic. Other side. Look all the way to the back without turning your shoulder. Breathe out first. Take a deep breath in. When you practice, do it about 5 times each one. Then slowly rotate. Drop your head down, turn your head to the left, to the back, to the right, then right to the back, to the left. With this practice, yoga is a holistic practice, not reductionist. That means I'm relaxing my neck, relaxing my chest and body, but it also relaxes the rest of my body, relaxing my back, my knees, my ankles, my, you name it, whole body. I feel a profound level of relaxation. And the proof is, here it is, I have a saliva in my mouth. So I'm in relaxation, and also see my hand has not come down. My hand is exactly in the same place. I feel in a state of comfort, a tremendous feeling. Then you incorporate a metabolic pranayama. Metabolic pranayama is called Kapalbhati pranayama. We have 3 main basic pranayama which you practice daily. One is called a Bastrika, bellows, active inhalation, active exhalation, which is called a Prano Pradhan pranayama. It brings prana in our body. Kapalbhati pranayama is an active exhalation, which is called Agni Pradhan pranayama. It ignites our digestive fire, called Jathar Agni, and it is also called a metabolic pranayama. It massages all the abdominal organs, and it is an active exhalation, passive inhalation. We practice this with all the mudras. There are 10 mudras, and we'll do the practice and we'll see. Third main pranayama is alternate nostril breathing, Anulom Vilom pranayama, which is called a Vayu Pradhan pranayama. It controls your vata. Generally, we practice about 50 Kapalbhati pranayama with about 10 mudras, which almost become 500. And for your practice, probably, let me show you about 20 Kapalbhati pranayama with each mudras. Origin of mudra is that our universe is made of 5 elements: space, air, fire, water, earth, and we also have 5 elements within our body. My book, my DVD, my YouTube, all the YouTube videos, they describe everything. So the space represented by the middle finger, air is your index finger, fire is your thumb, water is your little finger, and ring finger is your earth. Touching each one, you also quiet down your doshas, vata, pitta, and kapha. When the way to start with the Kapalbhati pranayam, Kapal means forehead and Bhati means shining. When you ignite your Agni, Jathar Agni, you develop tejas in your body. When you develop the tejas looks like that you are glowing, that the glowing phase you have, that is also called your the shining light, forehead is shining. So start with the first mudra, Dhana mudra, Jnana mudra. Then you bring your awareness to your belly button and push your belly button to the back, and it compresses the balloon. So you have a balloon here, you have a diaphragm here, you have another balloon here. It pushes the diaphragm, massages the lung and heart, and the air comes out. You don't take any breathing in, you breathe it without any effort. Say, I did not breathe in. Breathing in is effortless, spontaneous. You don't learn how to breathe in. The day you are born, you took a deep breath in. You learn how to breathe out. A lot of people say, I cannot do it. I cannot push my stomach back and air comes out. So what do you tell them? Why don't you try coughing? Then you say, why don't you do one thing? Why don't you try to cough with your mouth closed? Mouth is closed, trying to cough. It becomes a Kapalbhati pranayama. You do your neti part every morning. So do some drainage for the sinuses. Also, you can put your one hand and put on the hand, you will see. Air comes out. So this mudra quiets down your mind. Dhana mudra, Jnana mudra. Put an index finger down, put a thumb in the top, they call it Vayu mudra. Quiets down your vata. Vata is responsible for all the musculoskeletal disease, like a back pain, knee pain, hip pain, all the pain, and neuropsychiatric disorders. Again, do about 20 each. We do 50 each, but for your time constraint, I'm doing 20. And also remember, it massages all the internal organs. It massages your liver, massages your stomach, massages your spleen, massages your colon, massages your pancreas, massages your small intestine, massages your rectum and anal canal. For the women, it massages your ovaries, tubes, uterus. For men, it massages your prostate, massages your bladder. It also massages your diaphragm. Change your hand to the middle finger and thumb. This is called your Shunya mudra. It helps improving your hearing. When you massage your diaphragm, massages the organ above it. Two organ above is your lungs. Massages the lung, so air comes out. Active exhalation. In between the lung is your heart. It massages your heart from the bottom. According to yoga, any organ, when it gets massaged, it gets better. So massaging the heart, which we do all the time. Suppose somebody had a cardiac arrest. We do a CPR, cardiopulmonary resuscitation. Basically, we compress the heart, we're massaging the heart. People come to the emergency room with a cardiac arrest. We can do a left thoracotomy. We open the chest on the left side. We hold the heart and massage manually. So here we're massaging the heart from inside. We call it the internal CPR, cardiopulmonary resuscitation. Touch your ring finger and thumb. This is called a Prithvi Mudra. This is for your obesity, trunk and obesity. This is also to balance your kapha dosha. Simply put the mudras over your knees, close your eyes, and spine straight, about 1 per second, 20 times. Little finger and thumb, Varun Mudra, improves your water content. Very good for your skin condition, also for the bladder. It improves your bladder function. The women who had a little bit of stress incontinence do a Varun Mudra, 20 of them. When you keep practicing, when you become effortless, you can do a little bit faster without any effort in your breathing. Ring finger, little finger and thumb, Shakti Mudra. Strength. Get up in the morning, you don't have any strength, do the Shakti Mudra, or call it Prana Mudra. So I'm speeding up a little bit, but I'm still effortless. I'm totally in my normal breathing. Middle finger, ring finger and thumb, Apna Mudra, Pachan Mudra, digestion mudra. It helps eliminating every excess in your body. If you put your index finger down, it is called the Apna Vayu Mudra, or Hridaya Mudra. It is very good for cardiopulmonary function. Put your hands together, put your thumb up, Linga Mudra. It removes the flames in your body, and also the children, you'll see they do all the time. Lot of other mudras. It's called a Ganesh Mudra, it's called a Hakini Mudra, it's called your Shankha Mudra, in your Dhenu Mudra. All our mudras you do with a Kapalbhati Pranayama. You get a synergistic effect. Then your for the metabolic function, the next one you do what is called your abdominal lock, Udyani Bandh. You breathe out first, This is very important for your metabolic syndromes of truncal obesity. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. Also, when doing Uddiyani Bandh, you can do a Jalandhar Bandh, chin lock, and also call a Mula Bandh, what is called your Mahabandh. Wonderful practice is called Agni Sarkriya. In Agni Sarkriya, you do the Uddiyani Bandh, then your abdominal wall, you massage all the internal organs, massage your stomach to ignite your Agni, massage your pancreas to get your more insulin. So let me show you one time. We do it about generally 7 to 10 times between Uddiyani Bandh and the Agni Sarkriya. This is called improving your metabolic function. Use the hand again. I use the Adhi Mudra. Adhi Mudra is a very relaxing mudra. I'll be breathing out first. Take a deep breath in, completely breathe out, suck your stomach in, and massage the abdomen with the abdominal wall. Agni Sarkriya. Agni Sarkriya. Between Agni Sarkriya and your Uddiyani Bandh, we practice about 7 to 10 times daily for the metabolic syndrome. Quiet down our mind. See, all the pranayamas, the breath is the connector between body and mind. Pranayamas quiet down your mind to the point you enter into a state of meditation. One powerful pranayama to quiet down your mind is your Brahmari pranayama, bumblebee breathing. Shut down all of our senses, then you create a sound, vibration, which has the same frequency as the frequency of your brain and the body. Two frequencies interact, cancels, and it's called harmonic resonance. Index finger in the forehead. You can use a Shanmukya Mudra also, 3 fingers to close your eyes, thumb to close your ear, and close your mouth. You'll breathe out first, take a deep breath in, breathe out with the sound of a bumblebee. One more time. Then use pumping and cupping. Rub your hands, rub your hands. When you feel the warmth in your hand, if you're wearing glasses, remove the glasses, take the hands like a cup, put it over your eyes, let the eyes take all the heat from your hand, then massage your forehead, massage your eyes, massage your face. All the muscles are attached to the skin. When the muscles are relaxed, all the frowning goes away. All the lines in the face goes away. Take your hand, massage the ear, behind the earlobe, behind the ear, in front of the ear, inside the ear. There is a called auricular branch of the vagus nerve. It activates your vagus parasympathetic tone. Bring your hand, massage on both sides of the neck, as if massaging your carotid sinuses. Quiets down your cardiovascular syndrome and system and nervous system. Hands to the back, massage towards your tubercle, the attachment of your trapezius muscle and sternocleidomastoid muscle, both muscles supplied by your cranial nerves, quieting down your cranial nerve. Wonderful relaxation response. So we can do all the pranayamas, meditation, but for a disease specific, the one which is killing us, insomnia and a sleep apnea. For insomnia, we recommend all the relaxation asanas followed by your Murcha pranayam. What is Murcha pranayam is that it is a breath holding in inhalation along with your chin lock. What happens when you breathe out first, take a deep breath in and hold your breath, then lung starts to expand. When it starts to expand, it can go up to certain part, but we have the rib cage and it cannot expand anymore. At that moment, a reflex comes in called Herring-Brewer reflex. It is the activation of your vagus nerve, and slowly it brings your lungs back. So breath holding and inhalation, basically activation of your vagal tone. Then when you bring your chin down to your chest, which is called a chin lock, it massages your carotid sinuses, which is also activation of your vagal tone and parasympathetic response. So we do with your Dhyana Mudra or Jnana Mudra, put it in over your knees. We'll breathe out first. Take a deep breath in. Hold your breath. Slowly drop your chin to your chest and keep holding your breath. And keep counting, so how long you can hold. Wonderful experience. One of my friends shared with me, he said he was talking to one of his family member in India. It was evening time in India. He said, what you're doing? He said, I'm practicing Murcha pranayam before I go to bed. And that's what he said he learned it from one of our classes. For Ujjayi pranayam, for a sleep apnea, we do Ujjayi pranayam with your Jalandhar Bandh and left nostril breathing, which is called Chandrabhedi pranayam. What Ujjayi pranayama does, you slowly constrict your larynx. Larynx is supplied by two vagus nerves, superior and inferior laryngeal nerve, which are the branch of your vagus nerve. It activates vagus. Vagus nerve, about 80% is your afferent. That means admit. It takes all the signals to your brainstem, and 20% comes out called the efferent through your hypoglossal nerve, which goes to your tongue, and glossopharyngeal nerve, which goes to your muscles of the soft palate, called palatopharyngeus and palatoglossus. When you have a snoring, that is a sign that you are going to have a sleep apnea. So when you slowly constrict your larynx without any with a relaxation, that means you will see when you do a Ujjayi pranayam, your accessory muscles of respirations are not active. They are very relaxed. See, very relaxed. Still have a lot of saliva in my mouth. Even I'm almost what? Hour and a half I'm talking to you. So I'm again in a hand at Adhi Mudra, which is very relaxing. So breathe out first. Take a deep breath in. Completely breathe out. Then you breathe in and out with your larynx constricted, called resistive inhalation. When you want to go a little farther, it tightens up a little bit more. Then you can do like this. And you can incorporate chin lock and left nostril breathing. Let me show you one time. That will be your final practice for today. Breathe out first. Deep breath in. What a beautiful practice. Activation of the vagal tone, activation of carotid sinuses, left nostril breathing, activating your right brain, which is intuitive, female, cooling, parasympathetic brain. So it's all putting together. You are continuing a wonderful relaxation response and parasympathetic activation as a therapy for your metabolic syndrome. And this metabolic syndrome is killing us. That's the reason I'm presenting it. Thank you. And remember one thing, everybody wants to do meditation. Meditation will practice, see, we have done a meditation, how to start a meditation practice. When you prepare your physical body, prepare your breath, meditation will come to you. You don't sit down and say, I'm closing my eyes and meditating, because your body is not ready, breath is not ready. Okay, thank you again. This is another Saturday. It's gone by very quickly. We have a lot of other practices we can show it to you. Next time, we'll come back, maybe rest of the practices for metabolic syndrome. Okay, see you next Saturday. Bye-bye.